It is definitely safe to exercise during pregnancy. In fact, we encourage it. It makes pregnancy a lot easier, a lot more successful, and a lot more fun. There are some limitations for exercise during pregnancy. A lot of times it's individualized. It can depend a lot on what you were already doing before you got pregnant. But there are some obvious things. You want to use your common sense. They're actually listed on paper, but people would laugh. You don't need to go snow skiing. You probably don't need to go scuba diving. Running with the bulls is just not a good idea. But there are some things that you might think you can't do, but you actually can. And it really just depends on what you were doing before you got pregnant. The benefits of exercise during pregnancy include a lot of health issues. You actually can decrease your risk of preterm delivery, of preeclampsia, which is high blood pressure during pregnancy. Blood sugar management, for example, gestational diabetes, is better managed and possibly avoided if you exercise during pregnancy. Other benefits would include simpler things such as just if you are in better shape when you are pregnant, you will have less discomfort, less back pain. You can get around easier, you breathe easier when you're doing regular activities. It even decreases things like constipation. You will often shorten your time of labor if you are regularly exercising during your pregnancy. One of the best benefits of exercising during pregnancy is you're already in the habit, and after you have your baby, if you will continue to exercise, you will lose your baby weight faster. When you are planning to exercise during pregnancy, it's really going to be important to discuss this with your doctor because every plan will be individualized. If you're already exercising quite a bit, what you're going to be able to do will be very different from someone else who maybe isn't exercising much at all but wants to during their pregnancy. Obviously, during pregnancy, your body changes, and in that same effect, what you're doing for exercise will change. Things that are going to be very easy to do early on, whether it's light jogging or bicycling, that's going to change. So you may end up changing your exercise routine to things that are a little bit easier and less impact on your body, which includes trouble with your joints. Your ability to breathe as you grow bigger will change. So you would definitely have to adjust what you're doing throughout the pregnancy. And you can always talk to your doctor about that if you need some suggestions. There are not many things that will keep you from exercising during pregnancy, but there are some things you have to be aware of. If you already have heart or lung problems, you will have to be very careful and discuss that with your doctor before you would do any type of exercise regimen. Other issues, if you have a history of preterm labor or if you're showing signs of preterm labor during that pregnancy, you're probably going to limit the exercise you're doing. If you're pregnant with twins or triplets, other things that do increase the risk of preterm delivery will adjust what your exercise regimen would be, or possibly you will be told not to exercise at all. If you have low blood count or anemia, there are some patients with it so low that exercise might actually be dangerous to their or their child's health. So we do have some issues that we will actually tell you to limit or not exercise during that time. So one of the easiest ways to start, if you've not been a very active person before but you want to during pregnancy, is to start with short 5-minute bursts of activity. Just do something light, and what you do is each time you exercise, you can add 5 more minutes to that until you can work up to about 30 minutes of time. If you're not feeling any chest pain or shortness of breath, you can do 30 minutes anywhere from 2 to 5 times a week, and you've built yourself up to a pretty good exercise regimen. There's a lot of common sense in exercise in pregnancy. If it hurts, don't do it. If you have chest pain or shortness of breath, don't do it or slow down. There are a lot of changes that can happen very quickly during pregnancy. You may not notice until you're trying to do something you were already able to do and now you can't. The progesterone in pregnancy will make your joints very loose, so they're not as strong and stable. And so you really kind of want to avoid bouncy, jerky movements while you're pregnant. Some of of the things you want to do to be prepared for your exercise: drink plenty of water, make sure you stay cool. Those are two of the most important things, but they're also the most simple. You can also make sure you wear appropriate clothing, good pair of tennis shoes that has a lot of support, and other support clothing that you can actually wear during pregnancy, a good support bra, and there are even belly support belts that you can use to help with that. During pregnancy, some of the exercises you do, for example, yoga, you may be laying in certain positions. You want to make sure you go see someone who understands the positions that are best for pregnancy. You don't want to be standing up straight still for too long. Your blood actually will pool into your legs. That can cause you to feel dizzy quicker, and probably not during exercise, but your body during pregnancy is easier to form a blood clot, and so if you're standing for long periods of time, that actually increases that risk to someone who already has that increased risk. You don't want to be lying down for long periods of time, especially not flat on your back. And again, if you go to some place who offers pregnancy yoga or pregnancy Pilates, most of those instructors are already trained on knowing how to avoid those type of things. My favorite exercise to recommend during pregnancy is swimming. I feel like that it takes all the pressure off your joints. You're already going to tend to get hot easily, so you're in the water and that keeps you cool. So it's a nice exercise, and it's also very efficient because swimming itself is very intense. So 5, 10, 15 minutes of swimming, especially when you're pregnant, you can get a lot of exercise in a short period of time. Other very good exercises for pregnancy would be walking. Again, making sure you drink plenty of water and you're in a cool area when you do that. You don't want to be too hot. During pregnancy, your core temperature is up a little bit, but just a little bit of exercise can make you feel very hot, very short of breath, faint. So you have to be very careful. Make sure that you do drink plenty of water. We will say that so many times. And exercise in a cool place. If you do feel dizzy or feel like you're getting too hot, you need to stop immediately. And sit down, and maybe if you need to, you can lay on your left side. That's one of the best positions you can be in during pregnancy if you're not feeling well, and drink water. And if that doesn't make your symptoms go away almost immediately, you should always call your doctor. Some of the exercises you definitely want to avoid during pregnancy: the hot yoga. I mean, use your common sense. There are certainly poses you want to avoid, but hot yoga is in the range of the hundreds in the temperatures, so it's probably most women wouldn't even choose to do that anyway. So some of the sports that you can do early in pregnancy and maybe not later, or there are some exercises you would avoid completely. Some of our recommendations for avoiding are horseback riding, scuba diving. I mean, some of these things may seem very safe, but accidents can happen, and the things that change in your body during pregnancy make those more prone during those type of activities. Obviously, no contact sports. Flag football might even be a little too much. But you just have to use your common sense, really, with a lot of these activities. If you are exercising during pregnancy and you experience any of these following things, you should stop and call your doctor immediately. Signs of labor, such as contractions, leaking of fluid, vaginal bleeding. If you have shortness of breath or chest pain that don't go away with just resting for a few minutes, those are the type of things that your doctor wants you to call them about. You actually could exercise very soon after delivery. If you have a vaginal delivery versus C-section, that may be a little bit different answer. But as soon as we feel like you're safe to exercise, your doctor will let you know. And we definitely encourage it because it will actually help you lose your baby weight better and will usually give you more energy for those times when you feel a little tired, you have a new baby. So sometimes it is also a great stress reliever. So it's not just about the baby weight and being healthy, but also making sure that you can relieve the stress. Having a baby is great, but it can also be very stressful, and you sometimes need a release, and exercise is a great release for that. A few other things that exercise after you're done with pregnancy can benefit. Even though you've just had your baby, your risk of getting a blood clot in your legs is still elevated for a certain period of time. So your exercise after delivery will actually decrease the risk of blood clot in your legs after delivery. And it also will greatly reduce the risk of postpartum depression, which has gotten a lot more prevalent, and maybe just there's a higher awareness out there now of postpartum depression, but exercise is probably our most often recommended way to avoid